the connection of the implant matters. We can get into the intricacies of measurements of degrees of the connection, but we use an implant here that has a connection that is very tight fitting and no bacteria can get in there. The problem that patients have had where, oh, I've had implants and my brother has implants and they've had nothing but problems with them. They've come out, they has to get them replaced all the time. It's bacterial contamination, just like anything else. And if we can create the connection of the crown to the implant as far away from bacteria as possible, and with a connection that has a very tight-fitting connection that you can't get bacteria to get in there and harbor next to it, then you won't lose bone around the implant. And if you lose bone around the implant, that's when you start losing the implant. The implant level is bonded to the, or integrated to the bone. Then you have a connection that fits inside of that implant, and then you create a crown. Now I use that tissue zone, or the tissue interface between the tooth and the gums. I use a highly polished zirconia, because they found scientifically when they did the research and looked at it under a microscope that if you're using a polished zirconia and you have 4 millimeters of thickness of tissue there, that you can get that tissue to actually seal onto that zirconia. So much so that they've done the research that when they removed it, they found tissue still stuck onto the crown. So now we're creating a bacterial seal around the tooth so the bacteria can't go down and infect the implant.